girls who were dealing with the fact that their mom was dying. So, but I had great medical care, thank goodness. I had wonderful family and the best friends I could have ever asked for that brought casseroles over after chemotherapy and things like that. And I participated in a groundbreaking clinical trial, which is what ultimately saved my life. And so after I beat the illness and my daughters were raised, which was really the only thing I really wanted in life, was to see them go to prom and get their driver's licenses and go to college, I sought public office because I felt like I'd been given the gift of my life back, and I wanted to use that life to help others who were facing the same fate that I once did. So now as Lieutenant Governor for the state of Colorado, I've made healthcare advocacy one of my key objectives, especially lowering the cost of healthcare for Coloradoans, because as we know, the cost of healthcare is a barrier to access. So now, thanks to the Patient Protection and Affordable Care Act, I always use the proper term because the patient protections are some of the most important things in Obamacare. And the expansion of Medicaid, the uninsured rate in Colorado is the lowest that it's ever been. But the high cost of healthcare, as Jill mentioned, is a barrier to access for too many families and eats up a larger and larger portion of the family budget for Coloradoans who have insurance. So that's why we're establishing, as she said, the Office of Saving People Money on Healthcare. We're not giving it a fancy name that really sounds important. We're giving it a simple, understandable name because it really is important. And we're getting right to work on a few major priorities. We're looking to establish a way to import lower cost prescription drugs from Canada to save Coloradoans money on their medication. We're also working to create a reinsurance pool to help cover healthcare costs for patients with the most expensive ailments and in the most expensive areas of the state, which Jill mentioned are up in our mountain areas. This is a solution that has led to double-digit premium decreases in the individual market in other states. We're also looking for more transparency from hospitals so that both policymakers and consumers can look behind the curtain and see what's really driving the cost of healthcare. So I'm glad to say that there's a bill in the works right now that's already passed the House, and we're really excited about that legislation. So the Office of Saving People Money on Healthcare, and if you can come up with an acronym, we have a prize for you. We'll also work on innovative solutions like state-backed insurance options being proposed through bipartisan legislation that will also increase competition, lower premiums, and give Coloradoans a new option in the healthcare marketplace, especially in the highest premium areas of the state, again, which are the mountain and rural communities. But one of the most important things that we're going to do, and which is a lot of what you guys do, is focus on prevention, which is a lot cheaper than treatment and creates better outcomes for patients. I know if I could have prevented my cancer, I would have done that in a heartbeat. And this is something that I don't need to tell you all about. As I said, this is your area of expertise. As a department, you're already doing great things to reduce healthcare costs, and we look forward to working with you to continue those valuable efforts. One of the things I know about is the family planning program. I think I voted for that when I was in the legislature. It's the national lead on reducing teen births and abortions through the long-acting reversible contraceptive program. By removing financial barriers for women who want contraception, you're helping the state avoid nearly $70 million in costs, and that's no small chunk of change. The Medication Take-Back program helps residents dispose of unused prescription medications responsibly, helping to prevent opioid misuse and preventing water pollution. I worked on some of that legislation as well. Your PrEP program provides medications that protect those at high risk for HIV, which significantly reduces the amount of money spent each year on HIV treatment. And the Air Pollution Control Division, which I've worked with before when I was in charge of the emissions program for the state, helps us also prevent asthma and different cardiovascular illnesses because we have cleaner air because of you. So efforts to ensure safe drinking water that includes fluoridation provide numerous benefits to Colorado families and prevents a host of oral health care issues. Another important program that I know you do is the community outreach through the Radon program that tells Colorado residents about the importance of testing of radon in their homes. Given that radon is the second leading cause of lung cancer, this is a really important benefit that you guys give to the Colorado community. So these, of course, are just a few of the numerous programs that I know you do that help save Colorado countless dollars of healthcare costs each year. The governor is also committed to addressing social influences of health, the circumstances in which a person is born, lives, works, and plays. We're so impressed with the efforts being made by your Office of Health Equity to level the playing field and help all Coloradoans thrive. The Equity Action Guide, which you produce, is a tremendous resource for agencies and organizations. Your involvement in the Equity Alliance brings all the state agencies to the table to address the historic and systemic policies that create inequities to so many people in our state. So I really want to close by saying thank you for your public service, for your commitment to health for all Coloradans, and thank you for the work that you do every single day. The governor and I look forward to helping you keep Colorado the healthy and vibrant state that we all live in and that we all love. So thank you.
She said fire anything at her. So we're going to do questions and answers now, and Kendra and Leo are going to walk around with microphones. So if you could raise your hand and let us get a mic to you so that we can actually hear your question, that would be great.
And I'll take personal, professional.
Personal, professional. I don't know.
You might not get a straight answer.
Okay, I was wondering if the Office of Saving People Money on Healthcare had any specific programs in mind for transgender individuals in Colorado and reducing barriers to affirmation surgery and things like that and access to care generally.
We don't have any specific programs for people who are transgender, but I think every rock needs to be turned over to make sure that there is access to all people. One of my biggest areas that I've had passion for all my life is people with disabilities. And even though they don't really fit into the category of the Office of Saving People Money on Healthcare, that's another group that we want to reach out to. So, I think I always appreciate people like you bringing the issue up, because that puts it in the forefront of our minds again. And that is something that we will, talk about. Equity is really an important thing. Want to know what my favorite color is?
Actually, I got a couple of questions that we got prior to the coming here.
People that don't want to raise their hands.
Yeah. Oh, no, I'm just kidding. What does the governor's climate agenda look like? Specifically, can CDPHE expect to administer a state-level cap and trade program like California's in the near future?
That's a good question. So I know for sure that the governor wants to move towards 100% renewable energy. We have a bill going through the legislature, I believe, today, which gives local governments more control over fracking, for example. We've got some bills going through the legislature on zero emission vehicles, of which I walk the talk. I've had all electric vehicles since 2011, and I have solar on my house. And so I'm powered by the sun, which I'm really happy about. And so I know.
As a department, we focus on encouraging healthy behaviors. Do we have plans to begin engaging in the harm reduction spaces? Things like the support of drug legalization, the current proposal to legalize mushrooms, safe injection sites, and even opioid distribution to reduce the number of overdose deaths. Areas like Vancouver have seen an 80% reduction in overdose deaths since the safe injection sites became legal. Switzerland has seen a 50% reduction in crime, and Portugal has seen massive drops in drug use, crime, and deaths.
I just heard this morning, and I don't know, maybe Jill knows better than I do, that we had a bill that was going to go through on safe injection sites, and that was pulled by the sponsor. I don't know exactly the reason why the bill was pulled, but I don't know if there needs to be more discussion. I know there's pros and cons on both sides, and I've heard both arguments about that. Opioid deaths are something that, we know are, they're way too common. And so that is one of the things that we have talked about in our Office of Behavioral Health, is how we can reduce opioid deaths in general. And I think there's no one answer to that question. I think it's going to take a multifaceted approach.
So, I think, sorry, Mark. Let me go first. So my name is Stephanie Rucker. I work in the Air Pollution Control Division, but I had a question around how your reducing costs might incorporate mental health costs and supporting people going to therapy, to long-term psychiatric care if they need it. I love that we have CSEP here, but they can't provide psychiatric care for our own staff, let alone for the rest of the state. So I'm curious to understand how your efforts will involve mental health care.
Well, a lot of people have asked, well, what does the lieutenant governor really do? And other than hang around and wait for Jared not to be able to show up somewhere, and I get to go. There's several offices in the lieutenant governor's office. The Commission on Indian Affairs is there for one. The Aerospace Commission, I co-chair. We have the State Innovation Model, which is another fancy name that nobody really knows what that means, but it's been an effort that the federal government gave money to Colorado to integrate mental and physical care, and they've done just a ton of work over the last years, just excellent work. And then there's the Office of Electronic Health Information is also in the Lieutenant Governor's office, as well as Serve Colorado, which is AmeriCorps and those kinds of programs. So the SIM, State Innovation Model work, is about to wrap up. And we're trying to figure out a way to continue to figure out how to incorporate in primary care physician offices mental health, because there's a lot less stigma when a person goes to their doctor than their neighbors see walking into a mental health center. And we've done a great job across the state. There's still more to do on that, but that's one thing. I don't know, and maybe you are aware that the Ute Mountain Ute Reservation recently had several kids taking a really hard look at behavioral health, and trying. We already know that treating the whole person is really the best way to treat